Hello, welcome to today's episode of the Public Health Spotlight podcast. Today, I'm joined by Katrina, who's the DPH here at Westmorland and Furness. Katrina, great to have you.
Yeah, good to see you.
To get started, please can you tell us a little bit about your career journey into public health? You've had quite a unique one, quite a fast one. But yeah, it'd be great to hear it in your own words.
Yeah, okay. So I started with a social policy degree, and I think finishing that degree, I knew I wanted to work in the public sector, but didn't really have a clear idea of what I wanted to do. But my first job was in Oldham, working on the Healthy Schools programme, primarily focusing on drugs and alcohol. And from there, over the next kind of 3 or 4 years, really, I guess I had a variety of roles, mainly focusing on drugs and alcohol, but moving into other areas such as teenage pregnancy. So all things connected to public health, and generally working in roles where I had sort of one foot in the local authority, one foot in the NHS. So initially that was in Oldham and latterly in Salford. And then an opportunity came up with the setting up of the Alcohol Harm Reduction National Support Team in the Department of Health. So I moved into a role there. So national support teams were essentially sort of like peer support teams. So we'd go working in a similar way to local government association peer review, corporate peer challenges. So we'd go and visit an area for a week, speak to all the kind of key people working in that area, and then write a report that was presented in the same week, kind of identifying some of the strengths, some of the opportunities, and making some recommendations. And then we'd also provide some follow-up support around some of those recommendations. So I absolutely loved that job. It was a great team to work in, but with a change of government and changes in structure, that those teams came to an end. And it was at that point that I decided to apply for the public health training scheme. So I did my public health training in Greater Manchester. I think the public health training scheme is really good. It gives you that proper grounding in kind of technical learning, but also that sort of on-the-job experience that's a really good firm foundation for your future career, really. And then I finished my training working in Bolton, but a consultant job came up in Oldham, so I applied for that. Started that job in Oldham, but what I hadn't anticipated was that after I'd been there for probably, I think it was about 18 months, the then Director of Public Health decided that he was leaving. Had absolutely no intention of moving up into a Director of Public Health role at that point. But there was the first attempt to recruit wasn't successful. And so myself and another colleague were asked to act up into that sort of interim role. So did that for about a year. And I think there'd been another, at least 1 or 2 recruitment attempts during that period. And I think by the end of the year, I thought, actually, I've been doing this for a while. Maybe I'll just throw my hat in the ring. And so from there, moved into the substantive role, and did that role in Oldham for 5 years prior to coming here to Westmorland and Furness 2 years ago.
Yeah, brilliant. It's great career path, isn't it? And I think having exposure to those kind of different stakeholder groups that you have to deal with now and work closely with really helps. And yeah, that acting up opportunity is always a really good one. I think lots of councils should and do it, but yeah, I think it's a really good opportunity because you get to get exposure to the role and see if it's right for you. But yeah, can you tell us a little bit about that transition, because you might be the first DPH I've spoken to that's had such a quick transition from consultant to director, and then obviously stayed in that career path.
Yeah, I mean, it's certainly challenging. And I think quite often with interim and acting up roles, one of the challenges is that you're often still trying to cover your old role whilst doing the director role. So I think that does impact on to what extent you can fully step into the role. But it was a challenge, but equally I felt well supported in doing it. I was doing the Aspiring Directors of Public Health programme at the time, and some of the sort of coaching support that came through that was really helpful. And equally lots of support on the job, both from my own team and from the wider senior leadership team in the council as well. So it definitely felt like a challenge, but felt like I was well supported in doing it.
Westmorland and Furness is a relatively new authority, having split from Cumbria. Can you tell us a little bit about the challenges and some of the opportunities you've had in kind of building that public health team?
Yeah, so certainly that sort of opportunity to work in a brand new unitary authority was one of the attractions of the role, and it is a great opportunity to really embed public health across the workings of the council. So Westmorland and Furness was formed from what was half of Cumbria County Council and then the three district councils that covered Eden, South Lakeland and Barrow. Um, so I guess with public health coming over, actually, in some ways, that's a relatively straightforward transition in that the whole of the team they were all ex-county council and have come straight over. So we've definitely had to sort of build the team and fill some gaps. But, that's been great in terms of giving people within the team opportunities to develop, but also to bring new talent into the team. I think as well with forming a new unitary organisation, we've got some services that used to sit in the county, like public health, like children's and adult social care, for instance, but then also coming together with services that were previously based in the district council, like housing, parks, leisure. And that brings loads of really good opportunities for public health. So whilst, there absolutely was joint working between the county and district councils on public health before local government reorganisation, actually everyone being based in the same organisation brings with it new opportunities. And I think being sort of able to be involved at the outset means that we've been able to embed public health as new strategies and plans are developed. So, for instance, the new housing strategy, working on the new local plan for the area to make sure all those things that we'd want to see from a public health point of view are embedded. But there's also the more, I guess, day-to-day opportunities that come up. So we've been working with the highways team, for example, on bridge design to make sure that we can build in suicide prevention measures in new bridges.
So, what are some of the key public health priorities for Westmorland and Furness at the moment?
Okay, so as a really large area, you can imagine that actually some of the needs in different parts of our area vary quite considerably. I think one of the things that we have in common with a lot of areas, and is the case right across our patch, is that we have an ageing population. But for Westmorland and Furness, we quite often talk about the fact that we've got a super ageing population, in that it's a popular place for people to retire to. Which does mean that then, we see people growing older here. And I think our role in public health is to try and make sure that we're doing as much as we can to make sure that people can age well and age healthily. So that would include, things like work on falls prevention and frailty. But equally, how do we make sure that we are trying to work with colleagues to create age-friendly communities, for instance? We've also got some really widespread variation in health outcomes across our area. So in parts of Barrow, which is where we have our highest levels of deprivation, life expectancy is 16 years lower than it is in some of our more affluent and least deprived areas. Barrow is a coastal community as well, and I think some of the health inequalities challenges around coastal communities are well documented there. But there's certainly a lot of work that we do where we do have a greater focus in Barrow, because that's where we know we have greatest need. We are one of the most sparsely populated areas in the country, and so rural health again is a big issue. And we see that in terms of things like access to services, both in terms of kind of challenges with geography, transport, things like social isolation can be a big issue as well. And on housing, affordable housing is a big challenge in parts of our area. But also things like warm homes, fuel poverty, that whole agenda, they all play into health and well-being. On the more kind of specific public health topics, some of the outcomes where we are an outlier are sadly suicides and drug-related deaths. So they are a big area of focus for us. but equally as a new council, I think as a public health team, we've had a big focus on looking at all our services. Obviously, they would have been on county council contracts before, so we've had to review all of those and really think about what we want for the future, and have been going through the process of sort of recommissioning all of those as well.
Brilliant. Yeah, it's a lot of work, isn't it, all that recommissioning, but like you said, a good opportunity to be able to do it. Moving on to kind of discuss funding. So Westmorland and Furness is one of the lowest funded councils in the UK. Can you tell me a little bit about how you navigate that?
Yeah, so it's certainly one of the biggest challenges of the role here. So our grant is about £8 million, which works out as about £35 per head of population, which is less than half the average when you look across the country. So yeah, that certainly does mean we have to be very careful about everything we spend. It does mean that the vast majority of our budget does go on the sort of statutory or mandated public health functions. We don't have huge scope to do a lot of work outside of that, but that does mean that we have to be quite innovative, I guess, and make sure that we are really strong in how we work with other partners, to make the most of any opportunities that are out there. But yeah, it absolutely is a challenge, and particularly when you take into account the large geography that we cover. Delivering services in a rural area does come with additional costs. We can't have one service base, for instance, and put it in the middle of our patch and expect people to travel for an hour and a half to get there, when we know that there probably won't be public transport as well. So it means we have to deliver our services in a more dispersed way across the area. But also, it's like productivity is lower for something like health visiting. The number of visits someone can do in a day is obviously smaller if they've got to travel large distances between appointments. And our provider market is more limited as well. So when we go out to commission services, we often find that the range of providers that are willing and want to come and work in Cumbria is more limited.
Yeah, absolutely. You've certainly got some unique challenges, but yeah, you're doing a brilliant job, I believe. So, just moving on to discuss recruitment a little bit, because as you've said, the ruralness, it's such a difficult thing to do anyway, getting the recruitment right. Can you tell us a little bit about how you do that and how you've had success, and some of the challenges you face as well?
Yeah, so I'm really pleased to say that we have pretty much a fully staffed team here at the moment. And in general, we have found that as Westmorland and Furness, particularly when we've gone out to advert for public health project officer jobs, um, they we've been really welcomed the great response that we've had to those, and we've made some great appointments. I think where there are areas or posts where we know recruitment is going to be more challenging, we've thought about how can we kind of be as flexible as possible for remote working and things like that to enable us to fill some of those posts. I think consultant recruitment is the thing nationally that is really, really difficult. I feel really fortunate to have both my consultant posts filled, both with excellent consultants. But I do worry that should that situation change, what position we might be in. But I mean, both here and in Oldham, I've created roles within the team that are an opportunity for someone who's doing their portfolio route to specialist registration, to kind of take a more senior role in the team while they're doing that route, so that they're getting the opportunity to develop in a supported way, but also that we're kind of trying to grow our own as well. So I think that growing our own thing is something we absolutely have to think about for those roles.
So you mentioned Barrow there quite extensively. What are some of the opportunities that you have within Barrow? And also, I'd like to hear a little bit about its role in nuclear defence, because that is very unique.
Yeah, it certainly is unique, and Barrow's unique in many ways, not least because of its role in building nuclear powered submarines. It's the only place in the UK where that happens. But it's also got uniqueness in that it's at the end of a peninsula, sometimes called the longest cul-de-sac in Europe, I think. Which, some of that remoteness from major centres also creates challenges for things like bringing in the workforce that's needed in the area. And, the shipyard is very much a big part of the town, and over the years, the prosperity of the town has had its ups and downs alongside the ups and downs of activity in the shipyard. And that's where we see some of that sort of multi-generational unemployment kind of challenges come from. So we have a big opportunity at the moment with all the investment that's going into nuclear defence means that the workforce in the shipyard in Barrow needs to increase exponentially. And with that, there is a programme that we've embarked upon that's a joint programme across government, the council, and BAE Systems, who run the shipyard, to really think about how do we regenerate the town and make it a great place for people to live and work, and where people can really thrive. So that's both about improving outcomes for people who live there now, but also thinking about how do we really make sure that it's a place that people want to come and live and, raise their families and stay long term into the future as well. And with that programme, there is a large amount of government investment coming, so 200 million over the next 20 years. But we also have initially a £5 million pot that's about work and health specifically. So with that fund, we're looking at things like how do we make sure that we've got healthy, accessible workplaces. And this isn't just about the shipyard, it's about the whole range of employment opportunities that are needed in a town to support a population and to support an economy. So how do we make sure workplaces are healthy and accessible? What are the opportunities in thinking about the workplace as a venue for health and health improvement? How can we support people to remain in work or maybe get back to work if they have had some physical or mental health challenges? And also, how do we make sure that we're thinking about the future workforce and really supporting children and young people to make the most of those opportunities? So yeah, that is a big programme of work, and sitting alongside that, we're sort of also embarking on thinking about what does the future of public services need to look like as part of that transformation. 200 million feels like a lot of money, but actually with the scale of change that's going to be happening, how we use that as a catalyst for transformation and to draw in other investment is going to be absolutely critical to having that success.
Absolutely. And I'd just like to say, I think it's brilliant how optimistic and how positive you are about some of the challenges you face. Because Barrow is one of the most unique situations I think there is in the UK from a public health perspective and a funding perspective. So yeah.
It is, but there's so many strengths in the area as well. The community aspect is so strong. Voluntary community sector, there are a lot of strengths to build on there too.
Yeah, brilliant. I'm looking forward to seeing how you transform it and how you continue to help Barrow grow. Moving on to discuss aspiring directors of public health, what advice would you have for those that are considering getting into the field or looking to work in areas like Westmorland and Furness?
So I think take opportunities when they come up. I certainly feel like a lot of my career hasn't been overly planned, but when opportunities have come up, I've tried my best to take them. I think also think about breadth of experience. I think public health is different to a lot of medical specialties in that as you move up and move into more senior roles, actually your role becomes broader, whereas with a lot of medical specialties it becomes narrower and you become more specialist. So I think getting that breadth of experience is really important. But I think the main message is kind of go for it, because it's a great career and being a DPH is a fantastic job.
Brilliant. Great. Katrina, it's been great having you on today. Thank you for doing this with us. Please stay tuned for more episodes of the Public Health Spotlight podcast.